I think the sense is just the opposite, Michael, here at the Gateway Center, where we are in our 18th day of negotiations at this building behind me, where another marathon session continues, and the union is firm on this. If there is no agreement, then that strike begins at 6 o'clock tomorrow morning. While the sides have made progress on wages, the union says they're far apart on out-of-pocket costs for health insurance and staffing issues. The union wants staffing ratios in the contract, which would mandate so many employees per patient. It's the only way, they claim, to make sure staffing shortages, which the union insists are now exhausting their members and endangering patients, are resolved. While something like that as part of a contract isn't all that common now, a union representative explained why it should be included as part of any new deal.
There's a new New York state law. It requires us to have a clinical staffing committee in place in each of the facilities by January 1st of 2022. We have to negotiate some kind of ratios by July 1st of 2022, and they have to implement the ratios by January 1st of 2023.
So she says if they take care of that now, it's going to leave them more than a year to work out a plan to implement it. Meanwhile, the union announced today the formation of a patient protection committee. What that basically means is even if there's a strike, if there is some sort of disaster locally where it creates an all-hands-on-deck situation at local hospitals, then they have a team of members who are ready to go back in if requested. Reporting live from the negotiation site along the waterfront in Buffalo, Dave McKinley, Channel 2 News.